It's important that you know how to perform CPR because it can save your baby's life in an emergency. If your baby appears unresponsive, shout their name to get their attention. If there's no response, tap the bottom of your baby's foot and shout again. Place your baby on a firm surface, such as a table or the ground. Get close to their face, look and listen for breathing. If baby is not breathing or only gasping, call 911 if your phone is nearby or tell someone to do so. If you're alone and your phone is not nearby, immediately begin CPR for 2 minutes. Perform 5 sets of compressions and breaths, then call 911. Place your thumbs side by side on the center of the chest, just below the nipples. You can also just use 2 fingers, push down hard and fast. Give 30 compressions. Go 1.5 inches deep and at a rate of 100 to 120 per minute. Allow the chest to return to normal position after each compression. Tilt baby's head back slightly to open the airway. Give 2 breaths. Place your mouth over baby's nose and mouth. Blow into baby's mouth for about 1 second. Watch for the chest to rise and fall. If the chest does not rise, reposition the head. Be sure to have a good seal with your mouth. Give 2 breaths. Continue giving 30 compressions and 2 breaths. After 2 minutes, call 911 if you haven't done so already. Continue giving sets of 30 compressions and 2 breaths until medical help arrives or until you see obvious signs of life. We hope with these basic CPR steps, you'll feel better prepared to take action during an emergency.